So the mid-pregnancy scan is a very, very reassuring scan for you as it ensures your baby is doing good. Now, how to prepare for the scan? Essentially, no special preparation is required. You just need to avoid food which causes gaseous discomfort one day prior, because gaseous distension may interfere with a good visualization of the baby's parts. And this scan essentially takes about a good half an hour to 45 minutes. So come prepared for that duration of assessment. And it can also pick up if any abnormalities are there. Depending on what the abnormality is, the obstetrician will decide further investigations. Most of the time, the scan report will be seen by obstetrician immediately. And depending on what the problem is, we may ask for further tests like the non-invasive prenatal testing or amniocentesis, which actually confirms whether the problem is there or not. I'm Dr. Rita Singh. The mid-pregnancy scan is done in all pregnancies around 18 to 22 weeks of pregnancy. This is a detailed scan to look into the different structures of the baby. This scan will ensure that all organs of your baby is well formed, and it can also pick up if any abnormalities are there. So this scan essentially will look into all structures of your baby, from the brain, the central nervous system, the spinal cord. It will look into the heart, the lungs. It will look into the digestive system, the stomach, the kidneys, limbs. The sonologist will not only look whether the organs are well formed, they will also take the measures, wherein we see whether your baby is growing well. They will also measure the water, the amniotic fluid around your baby. The position of the placenta and the cervix is also looked into during this detailed scan. Most of the time, these scans will be very reassuring, and you will be happy and thrilled with the report you get that your baby is doing fine. Sometimes, however, it can pick up certain abnormalities, particularly structural abnormalities, and sometimes growth disorders also. So different problems in the baby like the spina bifida, the renal agenesis, the omphalocele, congenital heart diseases, etc., and certain skeletal problems can also be picked up during the mid-pregnancy scan. These are usually very rare, so no need to get concerned. Depending on what the abnormality is, the obstetrician will decide further investigations. Most of the time, the scan report will be seen by obstetrician immediately, and depending on what the problem is, we may ask for further tests like the non-invasive prenatal testing or amniocentesis, which actually confirms whether the problem is there or not. Sometimes there are minor issues which the obstetrician will keep in mind to deal with at the time of delivery. So the mid-pregnancy scan is a very, very reassuring scan for you as it ensures your baby is doing good. It is well formed, it is growing fine. So be happy that you have a good report after the scan. Now, how to prepare for the scan? Essentially, no special preparation is required. You just need to avoid food which causes gaseous discomfort one day prior, because gaseous distension may interfere with a good visualization of the baby's parts. And this scan essentially takes about a good half an hour to 45 minutes. So come prepared for that duration of assessment. So the mid-pregnancy scan will give you a good confidence that pregnancy is going fine. During this scan, the sonologist will check the position of the placenta, and they will also look into the blood flow to the baby. This is called the Doppler study.